Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
We are going to hear of another great doctor. And I always ask doctors, the first thing, and I introduce them, I always say, why did you become a doctor and why did you choose this specialty? So I'm going to introduce Dr. Charles V.TOMAN, and he is with Broward Health North. And for people that don't know where that is, that's right off Sample Road. But you know, Dr. Toman, you probably could have been anything. Could have, been a scientist somewhere, or you may be a football player. You have the body for it. You could have been anything. Why did you choose medicine?
Well, medicine was an easy choice for me just because I'm pretty close with my parents and my family. Both my parents are physical therapists, and they've been therapists in this area for probably 30 years now or more. And I actually had a summer job working at one of the local rehab facilities. And I saw really what my dad did to help people who were recovering from orthopedic surgeries predominantly. And so I was an aide, and I would walk patients back and forth. And my dad always said that, where there is motion, there's life. And he said, Chuck, you don't need to do complicated physical therapy. You just need to get these people walking. And so I watched him do that, and I saw people get better. And then one day, a doctor came to the facility, and the doctors didn't frequent the facility. They would just show up whenever. And there was this one doctor who was dressed funny, who was doing funny things with the patients, having them stand on one leg and try to lift this leg and do that. And I looked at him, and I just shook my head, and I was like, what in the heck is going on? And so I asked my dad afterwards what was going on, and I'm like, he's just he's a physiatrist. And I'm like, okay, so he's doing therapy, and he's like, yeah, he's doing therapy. And but why is he here? And he's like, well, he's a doctor, and he's going to institute new therapy. And I'm like, but Dad, you told me that you just need people to walk, and they do so well with just doing that. And he's like, yeah, Chuck, but he's a doctor, and so I have to listen to him because I'm the therapist. And I said, well, Dad, I don't want to be a therapist anymore. I want to be a doctor because I'm not going to listen to anyone that does crazy stuff like that. So that's kind of why, medicine was important to me, and I knew that I would do orthopedics. I was a baseball player, not a football player.
See,
so
I knew that you were an athlete.
I was a catcher, and so thankfully I had the ability to play some baseball, but I also did pretty well in school. And so what happened is I went to University of Miami, and I was accepted into a 6-year medical program. So I did 2 years undergrad, and I did 4 years of medical school, all in one. So I was accepted into the medical school out of high school. And I tried to play baseball, but, if anyone that knows baseball knows that University of Miami baseball is, there's no messing around. So that's a full-time job, and there was no way that I could complete my academic requirements to be in medical school after 2 years of undergrad and play baseball. So I had to give up one, so I decided to hang my cleats up. So that's my story.
That's a good story, and I can understand it. In fact, you mentioned a physiatrist, which there are not many of them around, and I had found out what they were, too. And they're a doctor, of course, as you said, but they're not an orthopedic surgeon. And so it's interesting that you wound up doing that because you do change people's lives from being invalids to being walkabouts. And I'm very thrilled about that. But there are a lot of kinds of orthopedic surgeons. Some specialize in hips and knees, and some specialize in shoulders. And I know that's something you really like. And I'm glad because it seems that a lot of people have problems, and you can help me describe this. All of a sudden, they have a rotator cuff problem. They have something happen to them. How does this happen?
So, you're exactly right. My practice is focused on sports medicine and arthroscopy, but I do probably more hip and knee replacements than anyone in Boca Raton. I do far and away more shoulder surgeries, including rotator cuff tears, surgeries for arthritis, replacements, complicated revision surgeries, all those things. But I love the shoulder, and the shoulder is something that I love because I find it to be more challenging than the other joints.
Why is that?
There's really an art to it. So, when you lift your arm up and you move it all around, the shoulder has a tremendous amount of range of motion. So you can, reach, between your shoulder blades. You can touch the top of your head. Your knee bends and goes through a range of motion of 0 or maybe, 0 to 130 degrees of bend. So, it's very good. It's like a hinge. The hip has pretty good motion, but there's lots of bony constraint. In the shoulder, we rely on the soft tissue as well as the bone. And so the reason that you can move your arm wherever you want to is because we have to rely on muscles and tendons and ligaments and bone to really help control the shoulder. So there's still a little bit of the art of medicine in the shoulder. So it's not just rote memorization, cut here, do this. It's really balancing. So you really have to listen to what the body is giving you, and you need to make adjustments here and there. And, it's a lot of fun to be able to be challenged differently every time.
Well, let me just ask you a quick question then. When my husband had knee and hip surgeries, and he had quite a few of them, he recuperated pretty quickly. I find people who've had shoulder injuries seems like it stays with them for a while. Why? Is it because it's a combination of the muscle and the bone?
You're exactly right. So when you have, say, when people think of a hip or a knee surgery, they're thinking usually of a hip replacement or a knee replacement. And literally, we're replacing the surface of those joints. And the muscles and ligaments and tendons, for the most part, are left alone. And so we have to go through them or around them to be able to get to the bones, but we leave most of that stuff intact. When you talk about shoulders, the much more common procedure in a shoulder would be, say, a rotator cuff repair, a tendon repair. And so what's happened is the tendon itself has failed, okay, and then we need to get that tendon to heal back to bone. And that takes time. So I am really good at fixing rotator cuff tendons back to bone. I mean, lights out, fantastic. But I'm not good enough to make the biology heal faster. And so for soft tissue procedures like rotator cuff repairs, we have to wait for the body to heal that into the bone. We do shoulder replacements, and shoulder replacement patients, for the most part, recover more quickly than rotator cuff repair patients, because similar to a hip or knee replacement, you put the pieces in and they go. It's a matter of soreness and building back some strength, not waiting for the biology to do its job.
Well, I see a lot of people exercising and they're doing it, a lot of crazy things. Is that how somebody can get their shoulder out? Tell me, when someone comes to see you, what have they fallen? What's their problem?
So I take care of patients of all different ages. So, every demographic of patient has a different way that they hurt themselves. And by the way, I love CrossFit and I love Zumba because they cause massive amounts of injury. So it keeps me busy. But no, those things, it's just like anything. Exercise in moderation is really what keeps people healthy. When you are excessive in any type of eating or any type of activity, that's where you get prone for damage, and injury that basically means that you have to come visit someone like me. But, it just depends. In little kids, when they have shoulder problems, a lot of times it's little leaguers who are overthrowing or they're throwing too many innings. And so for them, it can be as easy as building the core strength and basically adjusting their throwing schedule so that we can preserve them and prevent them from getting hurt. Teenagers tends to be dislocations. They're on skateboards or they're surfing and they dislocate their shoulder and they tear up their labrum or they tear up their rotator cuff. And those, a lot of times we have to fix with surgery to repair the stability of the shoulder. When you get to someone who is 45 or 50, they usually have an inflammation or a tendinitis. And so what that's from is from years of using your shoulder, having a lot of fun, lifting weights, doing exercises, dancing, whatever it is that people do, and they start to get a little bit of wear and tear and are more prone to inflammation. Then when you get to like 60, 70, you're looking at rotator cuff tears. So a lot of people think of rotator cuff tears as something that happens traumatically. And sometimes there are people that do have traumatic injuries. Like I have one guy who is about 6'5", very muscular, on a jet ski, jumping someone's wake, thrown from his jet ski, ripped his, either was going to fly into the rocks or he's going to hold onto his jet ski, and he ripped his rotator cuff apart. And so we fixed it. And, so that's a traumatic avulsion of the rotator cuff, ripped right off. Most people we see, though, are people who are like these weekend warrior type people that have been, who led active lives, who are now 60 or 70 years old, who have degenerative type tears of the rotator cuff, where maybe they had injury when they were 17, and then again when they were 30, and then when they were 45, and then they're 60 or 70 and their rotator cuff is failing. So that's the typical patient that we see. There's like a bimodal distribution. So you got young people who are too crazy or have an unfortunate situation, and then you have older people who may have been pretty crazy and calmed down and then just got a little bit older. And that's what we see.
Let me just tell everybody you're listening, this brilliant physician, saying more than I probably even have the right questions to ask him. Dr. Charles Toman, T-O-M-A-N, and he is practicing there at Broward Health North, which is over there on Sample Road. They're doing a lot of wonderful new construction there.
It's beautiful. It's beautiful.
Right, it's going to be great. Well, let's just, I always ask this too. as people are aging and someone comes in 85 and 90, are you going to take care of them and do the same thing?
Well, I mean, I take care of patients that of all ages, like I said. I mean, today I had a patient with shoulder pain that was 99 years old.
Yay!
And so, we take care of people. I had a guy that had a knee replacement at 94, which, I mean, he had to twist my arm so hard for me to do that. But he is a vibrant, active guy, and he literally looks like he's 74. He acts like he's 34. And we did that, and we have great success with that. But the procedures that we do in the older patient, we have to adjust, because as people get older into their 80s and 90s, their biology is not as good as what it once was. And so oftentimes when people have a rotator cuff tear that's substantial and they're 80 or 90 years old, or even in the 70s sometimes, what we'll do is we'll kind of have to just say, you know what, your biology is probably not going to heal this. I can go through a beautiful surgery. It can be literally done perfectly. But again, we're relying on that biology. So there are other options that we can do. And so some of those options are replacement surgeries. And replacement sounds horrendous and scary to people, but really the replacement surgeries we do in the shoulder oftentimes are much easier to recover from, less painful than doing a rotator cuff repair, because we can start motion right away. We can immobilize for a much shorter period of time.
Yeah, I was thinking, of course, with your parents being physical therapists, you understand all that probably more than even doctors.
Well, I'm kind of forced to pay attention to all of that. But yeah, no, I respect therapists very much. And, my wife's a therapist. My parents are therapists. We have a family that's deep in medicine and therapy.
And so that's really the key, though. Once a person has gone through this, for them to appreciate what physical therapy means. And if they don't do it, what's going to happen?
Right. I mean, it's, the necessary part. I tell patients often that, you look at like a pie chart of what their surgery is all about. About 10% of it is me and what I do. And about 90% of it is really what they do with their therapist over the next 3 months. So they'll see me for, say the procedure takes 45 minutes. I'll take care of them in the hospital for a day or two on some people. Most people we do as outpatients. And I'll see them at 2 weeks, 4 weeks, 14 weeks, 20 weeks. For a few minutes. So again, my part's very important, and it can't get done without me. But the true people that are working the hardest would be the therapists and the patient themselves.
So how many of these operations can you do in a day successfully?
I did 11 surgeries yesterday.
Oh, come on, you're kidding.
So
11 surgeries?
I did, yeah. So that doesn't happen because it's just me. I mean, I have a whole army of people that work with me, for me, around me, that support what I do. And so that's a little bit abnormal, but it was a day where some people came in and they were broken, and it's hard for me to let people just sit and be broken when we can do it. So we were able to do that, but
what were some of them?
Shoulders, hips, knees, people that broke their legs, and different things. So at this point in my career, I still do a fair amount of general orthopedics, and it's funny. I even had patients that came in and they heard through the grapevine that I'm starting to give up doing some hip and knee procedures to focus more on shoulders. So that's, I'm really trying to get there. But again, when people need me and they ask for me, it's hard for me to turn them away. So we had a busy day yesterday, but I was home by 6:45. We started at 8:00. And it worked out well. But, that's a concerted effort of the entire team. And that team is nurses, scrub techs, people that clean instruments, volunteers that push patients around to get them lined up, people that draw blood, people in the blood bank. I mean, it's really a team effort.
I'm so glad you mentioned that, because a lot of doctors, and I'm sure you know some, see themselves as the king of the hill.
Well, I am the king of the hill.
Okay. I know, but the fact that you don't really look at everybody else around you. So I'm really very pleased that you feel that way, because sure, you are the professor teaching, but then working, but then on the other hand, you couldn't do it with everybody else not supporting you.
I couldn't do what I do without probably about 40 people supporting me every day. Again, some of those people work for me, with me, and a lot of people just work alongside me. And some of those people I don't even see, and they just get things done. And that's how a team works.
And this isn't your field probably, but pediatrics, are there surgeons that do exactly what you do for the children? Do they have problems with it? You were talking about the kids with the shoulder. Now, would they come to you, or they go to a pediatric
So it just depends. So anything with a shoulder, I can take care of, from a little baby to to a 104-year-old person. So there are some pediatric orthopedic surgeons that focus in on just kids, and sometimes parents will feel like, oh, well, my kid's a kid, so I'm going to send my kid to a pediatric orthopedic surgeon. And that's great. I mean, pediatric orthopedic surgeons are great, but I get referrals from some pediatric orthopedic surgeons who need help with shoulder things. So there's kind of a split there. There are some, I mean, I have a great friend in Fort Lauderdale that, you know, he's a pediatric orthopedic surgeon, and he does a lot of the same things I do. I mean, he doesn't do replacements and things because kids don't usually need that, but he does some of the surgeries I do, and that's great. He's a great guy, you know. But no, I see kids, and we take care of kids' problems for many things.
My guest is Dr. Charles Toman, T-O-M-A-N, Charles V. Toman, and he has great credentials, and he's now, though, doing his work at Broward Health North. And so if someone wants to talk with you, are you also in private practice?
Yeah, no. So my practice is completely private. So I'm on my own. It's my own, you know, my own company, and we have our own office. But we do work at a couple of different hospitals, and one of the hospitals that's been very supportive of me has been Broward North, and you know, it's a fun place to work. There's good people, beautiful new facilities. They just opened 6 new operating rooms there, which are amazing, and you know, and they've been very supportive of me trying to develop a real center of excellence for shoulder surgery. And the end game for me is to provide a better and higher level of service, more efficiently and more safely to patients who need us.
That's excellent. So I see a phone number. They could call you at 561-221-6895.
That's my office number.
That's your office number for that. Well, when we talk about all this, you know, it's interesting to think about where it's come from. Now, you're young, but if we took a surgeon 40 years ago, it was very different, wasn't it?
40 years ago in shoulder surgery, it was a different world completely. So pretty much none of what we have now was available. It was in its infancy. So
maybe they didn't even do it, and you just lived with something like that.
Yeah, I mean, they tried to do some things. I mean, there is a guy named Dr. Neer who invented shoulder replacement surgery and things like that, but everything that they had was very rudimentary. You know, so I mean, even in some of the lectures I do, because I'm a consultant for many different companies, and I teach other surgeons from around the world. And one of the talks that we have has to do with the history of shoulder surgery. And really, one of the first shoulder replacements ever done was done for someone who had tuberculosis of the shoulder joint. And the shoulder joint was destroyed, and you know, and they put a resurfacing in there for the shoulder. I think it was an old hip, believe it or not, prosthesis. So again, it's definitely, shoulder is definitely a field with a ton of innovation, and there have been dramatic changes even in the last 10 years that have really changed and improved the lives of millions of people.
Isn't it the materials that have changed that you're using?
It's the materials,
titanium and
the materials and the understanding of the way the shoulder works. So, for instance, one of the greatest innovations in shoulder surgery is something called a reverse shoulder replacement. And so everyone asks what the reverse part means. And in that shoulder, what we do is we actually put the ball that's normally on the arm side, we put that on the socket side, and we put the socket on the arm side. So patients never will see that difference unless they see their x-rays. There's some, your shoulder looks a little bit more square instead of rounded after that procedure. But what that procedure does is that helps people who have rotator cuff tears that are irreparable, so that can no longer be fixed, or that were fixed in the past that failed, or people who had regular shoulder replacements that failed, or people with horrific fractures that can't be put back together. And those people would, in the past, have been treated with ways that were just inadequate. And now we have this device that will literally allow people to lift their arms, to have strength, to maintain independence, to hold a walker so they can keep walking, to get them off narcotic medicines. And that was really brought back to the United States in 2004. So it's only been 12 years, and it's really just gone through the roof success-wise.
Well, that's excellent. That was an interesting little story that nobody would have known.
I've got lots of stories.
You do? That's
lots of them.
Great stories. Well, that's what we like on the radio. We have to have you come back again. I want to continue with this. So do you, when you have had your operation, performed an operation, do you have certain kinds of dietary concerns for people? There are things that are going to help heal quickly, or you send them to a nutritionist?
Well, I mean, for the most part, I've been lucky. Most of my patients have been in pretty good shape. I mean, people that that need shoulder surgery, a lot of times are, we've already auto-selected. They're trying to get back to activities. They're trying to be, get back into tennis and golf and different things. So they try to keep themselves in shape. But we routinely talk about nutrition. I think the, important part of diet is, balance, just like anything else in life. So I tell people to, everything in moderation. We don't really put people on set nutritional supplements. Some people do. I mean, we do offer some products in the office that, literature on products that they may want to try to improve their nutrition. But
more protein to get
exactly. You want to have a balance of protein. You don't want too many carbs, but you need some carbs so that you can actually burn the protein. A little bit of fat, so you have at least a little flavor, but not too much, so you don't, get atherosclerosis and all of those things. So it's all balanced, but for the most part, it's just trying to promote a healthy lifestyle, and that's pretty much it.
Do you ever see patients again? I mean, do they ever, you've done this and then they fall again and you have to do revisions?
Occasionally we'll have people that where we do a procedure and then they fall or they get hurt or they're in a car crash or something and then they need something revised. And so we do that. Thankfully, my practice has been pretty successful in keeping people moving forward, and we haven't had too many setbacks, but occasionally we will have those. And again, that's just part of my practice. So for these complicated procedures, if you're doing a complicated primary procedure, the first go, well, then usually you're the guy that takes care of the complicated revision scenario. So yeah, we have all kinds of tools in our armamentarium to handle all of that.
Let's go back to what you said about CrossFit, because I know that I see,
I love CrossFit.
I see these, you love CrossFit.
Love it.
I see these people running, they come back and they're running and they're going in. What is that all about?
So, CrossFit, I think, is really it's kind of like a way of life. I think there's been a resurgence in people wanting to be healthy. And then I think just like people can be addicted to coffee or be addicted to drugs or be addicted to whatever, they're literally addicted to driving their bodies to the limits. And I'm a fan of that. Again, like some people would say that I'm crazy that I did 11 surgeries yesterday. I must have been tired and exhausted and did all that. I still went out to dinner last night and had a great time afterwards. And I paid for it a little bit today. I was a little tired this morning, but I feel great now.
Well, you're sounding great. So, it'd be good you did that. Maybe you would be flying off the walls of the studio.
But again, it's all just balance. For CrossFit, our babysitter does, she did CrossFit for a while because she wanted to have a challenge. She wanted to be able to do things that she otherwise wasn't able to achieve or do by just doing normal, yoga exercise or whatnot. But I think you just have to be. What is it?
What actually happens in CrossFit?
So in CrossFit, I think it's it's basically like circuit training utilizing, kind of interesting things. There's lots of kettlebells, which are heavy weights that you kind of swing around. There's doing squats. It's a very organized sport now. They actually have
tires. I know they're tires because they put tires down. I can't believe that.
That's the part that everyone sees is the tires. But sometimes they'll have these monster truck tires or tractor tires and they literally flip them and do it. Or they have big heavy ropes and they swing them. There's a whole competition. I personally don't do CrossFit, but I have a lot of friends and colleagues that do that. I sit next to a guy at soccer practice on Mondays and Wednesdays, and he's telling me about his CrossFit things. And, there's physical therapists I know that do it. But yeah, it's just basically just trying to do exceptional things with your body using some exceptionally fun type activities. But again, if you're flipping over a tire that weighs several hundred pounds with your shoulders, guess who you're going to see eventually? Me.
I was just going to say that, right? Go CrossFit. No,
I love CrossFit, like I said.
Then you said you love CrossFit. That's right. Well, it's really interesting talking to you because I always ask, as I said, why have you become an orthopedic surgeon? You could have become a gynecologist. There, so many other fields that are good, but you did have the good reasoning. Are your parents still physical therapists?
Yeah, they are. My dad works for a home health company and sees patients, and my mom works at the hospital and does inpatient physical therapy. I'm trying to convince her to retire so she can spend time with her grandkids.
No. Don't let her. Okay, but no, don't let anyone ever retire.
Maybe part-time.
No, yeah, part-time. That'll be very good. Well, we're very happy to have you with the Broward Health system because I've certainly been, I'm admiring you, and especially I know you're not going to do 11 anymore. We don't want you to have to do that, but at least you're up for emergencies. As a matter of fact, I know Broward General had that big emergency when that shooter was there. And
Correct.
Boy, they all came and everyone work like crazy. Hopefully you don't have any of those problems up here.
I hope not.
But one thing that's happening is the hospital is just going to be gorgeous. We're all working on fundraising for it, to have the new neuroscience department. And so, it's going to be a wonderful place.
No, it's great. I mean, it's been nothing but kind to me since I've started there a year ago. So
right. Well, it's in a good location, and we're just going to make it look pretty and going to have great doctors like you. So I want to thank you very much for taking your time to be with us.
Well, thank you so much. It was a pleasure to be here.